So from now on, what you've been able to make a diagnosis, you've been able to classify your patient. So what would be the
Yes.
specific management that you would give your patient at this point of time? I want you to be specific about all points that you would consider in the specific management of this patient.
Yes, sir. Initially, medical management wise, we need to have a strict BP control. This is a level 1 recommendation. The BP should be less than 180 mm of mercury, and the map should be maintained. Map should be maintained above 80 and should be treated if the map is less than 80. And the rebleeding chances for these patients, even if you treat, would be high, very high if the BP is more than 160. So tight BP control is the first thing we need to do, and the specific management would go for intervention by prompt obliteration of that ruptured aneurysm.
Okay.
Uh,
May I ask you, if this particular patient had a blood pressure of 170 on presentation, would you would
okay,
you would you go and
I will.
reduce the blood
I
pressure?
won't treat it. I won't treat it immediately, sir.
Okay. So whereas if this patient had a blood pressure of say 200, would you treat
Uh,
it?
yes, sir. We should treat it. It should be below at least 180 mm of mercury.
Okay. And maybe 180, but yes, that's right. That's the recommendation. But you understand that it gets reduced to much lesser in most of the other units. But definitely don't
Yes,
allow it to go to less than 160. I'm very happy
less
if
than
you
160.
keep it around. I'm very happy if you keep it around 180. Yeah, that's right.